What is blepharitis and how can it be treated? Blepharitis is one of the most common eye problems that any ophthalmologist sees. It's incredibly common. The term blepharitis means bleph means eyelids, itis means inflammation. So it's a term which covers many different types of conditions, but in all of which inflammation on the very edge of the eyelid is the core abnormality or core sign that we see. Typically, what we think happens is that we live in many of us in cities with poor quality air and with lots of pollution. And what happens is these particles and this pollution tend to, when they enter our eyes, they tend to build up or accumulate on the edges of the eyelids. This combined with collections of dead skin, of oil products from the oil glands, and bacteria living on the edges of our eyelids kind of forms an irritant layer or a kind of a toxic collection on the edges of the eyelids. And in some patients, when this reaches a critical amount, they notice that they develop irritation, grittiness, soreness, and tiredness in their eyes. There are lots of different subtypes of blepharitis. In some people, the irritation is mostly on what we call the anterior or the front part of the eyelid. Some people it's in the middle, and some people it's on the back surface of the eyelid that the blepharitis is most active. There are slightly different treatments depending on which type of blepharitis you have, but the core principles of treating blepharitis are to treat the cause, but also treat the effects, so the manifestations. So in terms of treating the cause, removing the layer of pollutants, debris, and skin from the dead skin from the edges of the eyelids is extremely important. And there's numerous proprietary wipes and special eyelid hygiene wipes that you can use to do that. But then in terms of treating the consequences, which is the damage on the surface of the eye, the inflammation and the irritation, very often in a course of anti-inflammatory and sometimes antibiotic eye drops are required to settle down any inflammation that has been stirred up as a consequence of the blepharitis. There's no one single drop. It's very much a set of treatments, both cleansing, sometimes nutrition, also combined with medication that we can prescribe as consultant ophthalmologists. It's a set of treatments which typically settle down blepharitis within a period of 4 to 6 weeks.